4 short weeks ago, I recorded our first COVID-19 video, but now that seems like a long time ago. It reminds me of the arrival of our first child, Madeline. After a month of being a parent, it was hard for me to remember what life was like before she arrived. The changes in and around our community are coming fast and furious, and the new normal that we keep trying to adapt to, well, even that seems to be changing daily. Over the last few weeks, over 40 states and the District of Columbia have issued some form of stay-at-home order. Last week, Valley Health joined with 20 representatives from public schools, institutions of higher learning, local governments, elected officials, law enforcement, and EMS to speak with one voice in support of these orders. Our message was delivered through local newspapers and social media, and it was very clear. If you stay home and practice social distancing, you will save lives. These are the single most effective ways to lower infection rates and slow the spread of COVID-19. It's also probably one of the most difficult challenges you have had to face in recent memory. Being separated from friends and loved ones is never easy. And I want to thank each of you personally for the sacrifices you are making to keep our community safe. In the last 7 days, Valley Health leadership, physicians and providers, and all of our staff have worked around the clock to strengthen our defenses and to double down on our efforts to limit the exposure while providing safe, compassionate care. In that short amount of time, we have quadrupled the number of respiratory care clinics available in our region, going from 1 location to 4. We now have respiratory care clinics located in Winchester at Rutherford Crossing, in Front Royal at Riverton Commons, in Newmarket, Virginia, and at Berkeley Family Medicine in Martinsburg, West Virginia. These clinics provide a safe environment for patients who are exhibiting symptoms of COVID-19, such as fever, cough, or other respiratory symptoms, to be seen in person by highly trained medical professionals and even receive an X-ray if necessary. Additional information on our respiratory care clinics, along with our COVID-19 respiratory care line, can be found on our website, valleyhealthlink.com. In addition to the respiratory care clinics, as the spread and prevalence of COVID-19 continues, we have had to adopt a number of extreme measures, including the elimination of visitation, canceling all public events and education programs, which has now been extended through June the 10th, closing our wellness and fitness centers, and postponing elective surgeries and procedures. While we have tried very hard to maintain access to as much healthcare services as possible, we decided that the responsible thing to do now is to curtail many of our outpatient diagnostic services. And we regret any concern or inconveniences this may present. But we found that it was necessary to protect our patients, our team, our providers, and the community at large. Valley Health will continue to provide outpatient testing services to those whose physicians have determined that the services are needed urgently or emergently. You may have already heard me express my gratitude for the more than 6,000 men and women who make up Valley Health. So many individuals and community members have stepped up to show their support of us through donations, words of appreciation, prayers, signs, food, and more. And they all thank you. Please know that we are not out of the woods at this point in time, and that there are many rough days ahead of us. If you have friends, neighbors, or relatives who work in healthcare and at Valley Health, please be sure to let them know how much you appreciate everything they are doing on the front lines. You don't have to understand exactly what their jobs are. You just need to know that without them, we would all be lost. And remember, the only way for us to be healthy is together.